I'd always been interested in the sciences, and in undergrad I did an additional research study looking at plant genetics. And so I've always had a strong interest in genetics, and it's really neat because I've been able to incorporate that into my practice today. But after undergrad, I wasn't quite sure what I wanted to do, so I took some time off and I actually pursued a career in medical supply sales. And I did that for most of my 20s. But during my work, a combination of stress, poor diet, not taking care of myself led to chronic stomach pain, anxiety, depression, eczema, even on my face. So that was really frustrating. And then, just after several rounds of medication and steroid creams, I really wasn't getting any better. And so a family member actually referred me to a doctor that practiced naturopathic medicine. And the results for me were they were life-changing, and it really opened my eyes as to how I think medicine should be practiced. And that inspired my current career in naturopathic medicine. And so the next slide. So why naturopathic medicine? And so for me, it just really made sense. It was about building health and addressing the underlying cause of a symptom or condition. And then I also really liked the fact that it was personalized. So, the combination of genetics combined with lifestyle and then environmental exposures, all of these things can really contribute to our current state of health. And then, so my weekly routine. So a big part of that is planning the week. And so Dr. Bisco and I we worked with a business coach for the first 6 months we opened, and that was really helpful. It helped me to realize that we have to be intentional about everything we do, and that winging it typically does not work well in business. And so as a new business owner and doctor, I'm wearing many hats. Right now we are working probably around 9 to 10 hours a day, and that's just early on to really get the practice up and running. But fortunately, I love what I do, and Dr. Ashley Bisco is an awesome partner and friend in this. And we really get to spend a lot of time doing what we love: patient care, continuing education, and then making time for self-care and family is also really important. And so then the endometriosis overview slide. And so just a little background on this. So endometriosis happens when tissue from the uterine lining or the endometrium becomes implanted outside of the uterus in other locations of the body. And so the ovaries tend to be the most common site, and they can develop endometriomas, or also called chocolate cysts. Other common sites include the colon and rectum, but endometrial tissue has really been found everywhere in the body except the spleen, interestingly. And so this misplaced tissue grows and it bleeds in response to estrogen associated with the cycle. And that bleeding can be really irritating to the nerves. It can cause quite a bit of pain, and infertility is also very common with endometriosis. And so then the next slide, some of the symptoms commonly associated. So it's estimated that around 6 to 10% of women who are of reproductive age suffer from endometriosis. A recent PubMed study that I read actually estimates that even up to 15% may have it. And it's really common for women to go undiagnosed for years, and that's why it's really important to know the symptoms of endometriosis. And so then the next slide, the diagnosis. And so you can actually treat presumptively based on history alone with a pelvic exam. Oh, sorry. Okay, so with a pelvic exam that may be uncomfortable or painful, they may have enlarged ovaries or cysts, and the organs may not be freely movable due to adhesions. Imaging, so that may reveal the chocolate cysts on the ovaries, but the small or diffuse endometrial implants don't typically show up, so it can be tricky to find in some cases. And they are currently working on advanced biomarkers, genetic inflammatory markers, but those have not been put into practice yet. And so then the next slide is a picture. It's just showing the implantation of endometrial tissue that can lead to adhesions between the uterus, the rectum. And then the next slide is, what actually causes endometriosis? And so the exact cause is still not fully understood, but they definitely know there's a few things involved. So genetics are definitely a risk factor. According to the National Institute of Health. First-degree relatives of someone with endometriosis, they're about 6 times more likely to develop the disease. And they have found some specific genetic alleles associated. The 4G allele of the PAI1 genotype can affect fibrin deposition and promote growth. Lifestyle, so there's a lot of lifestyle factors, especially diet. So estrogenic foods, gluten, sugar, alcohol, processed foods, conventional meat can be problematic. And then eating more fruits and vegetables can be protective. Environmental exposures, there's an association with dioxin, PCBs, and other endocrine disruptors, which are chemicals that act like hormones. And then also environmental exposures includes infections. And so these infections can also lead to chronic inflammation and immune challenges, which are also associated with endometriosis. Some of the other theories, like retrograde menstruation, they estimate that really most women, even 90% of women, have retrograde menstruation, and the real challenge is the immune dysfunction associated with that. And then the lymphatic or vascular distribution, that may explain how the endometriosis can end up in distant sites, such as the lung, brain, scans, or even the eye. And then the next slide is a diagram. You can see how certain foods contribute to inflammation associated with endometriosis, and Dr. Bisco actually made this for our practice. It's always nice to kind of make the connection for patients so they can really understand how the foods they're eating are contributing to the inflammation and pain. And so then the next slide talks about the conventional approach to endometriosis. It's important to know how it's treated conventionally. Pain management is one of the main things, and a lot of women do require narcotics because they are in so much pain. And so, treating this really can be life-changing for people. Hormone therapy is also commonly used. Oral contraceptives, progestins, intrauterine devices. And I will say the gonadotropin, GnRH, the gonadotropin releasing hormone, agonists and antagonists like Lupron, those can have really terrible side effects along with the aromatase inhibitors. So, there's a lot of things we can do to help these patients, and hopefully they'll never need those medications. Surgery is actually a really common treatment, and it can really decrease pain and be very helpful. But unfortunately, the problem typically comes back if you're not addressing the underlying immune and endocrine problems. And so then the next slide, the naturopathic approach to endometriosis. And so one of the things I love about naturopathic medicine is that you're building health. So no matter how complex the case, you really always start with the basics. And one of the things I always like to point out is, you can change your diet, you can take supplements, but those things won't work if you're not sleeping well, or if you're continually exposed to harmful chemicals, or other things that can throw your system out of balance. And so that's why we always start with the basics. So it's really important to support mental, emotional health. Having a good support system is important. Stress management. Sleep, nutrition, hydration, so obviously you can read those, but again, addressing all the basics. And so then the next slide shows a handout that we give all of our new patients, and this is called Back to the Basics. And so again, this is really addressing those foundational items. And so with relation to endometriosis, stress management is so important. And so things like yoga, meditation, having a good support network from family and friends is so important. So with sleep, we talk a lot about having a relaxing bedtime ritual and avoiding blue light. And this is a big one today because all of our devices are laptops, phones, iPads, all of those things emit a blue light, which can signal to the brain that it's daytime. And so then we don't make the melatonin needed for sleep. And there's actually some studies showing that melatonin is helpful for endometriosis specifically. So going back to the basics can be really helpful on many levels. So, with nutrition, so especially with endometriosis, it's important to avoid toxins and processed foods, especially conventional meats. I do find patients feel much better when they avoid typical cow's milk dairy. It's a little bit controversial because some of the studies have shown some improvement or association with dairy being helpful, but in my practice, my patients feel much better off dairy. Sugar and alcohol too, it's important to avoid that. And then, eating foods like our sulfur-rich vegetables, those brassicas, the smelly sulfury cabbage, broccoli, cauliflower, those actually contain compounds that can help with estrogen detoxification and breakdown, and which can help with endometriosis. Hydration, so it's always important to be drinking water, making sure we're supporting good bowel movements and detoxification. Digestion plays another important role in endometriosis. Exercise is great for overall health and decreasing inflammation. And then we also talk about avoiding harmful chemicals because, again, there's so many things in our environment that can confuse the hormone signaling. And so the next slide is a handout. It's actually a snapshot of one of the handouts we give our patients. So sources of the most common toxins that disrupt our hormones. And so again, these are all endocrine disruptors. So NDs are always working to educate their patients and provide useful resources. And these can be really helpful so the patients understand why we're recommending what we're recommending and then giving them the tools that they need. And so the next slide, we're going to talk about a case. And so this is a 36-year-old female. Her chief complaint was fatigue and painful heavy periods, and she also had IBS-like symptoms for 12 years. When she came to see me, she had already been diagnosed with endometriosis, but she had a number of other associated things, the fibroids, cysts, very heavy cycles. She had eczema since childhood, and with endometriosis, there's a lot of other immune challenges, including, in some cases, autoimmunity, allergies, and eczema is also on that spectrum. And she also had very low ferritin. Her ferritin was actually a 2 when she came to see me. And then just to give you a frame of reference, I typically like to see ferritin around 50. So 2 is pretty scary low. And I did refer her to a hematologist for a potential iron infusion. Just a little background on her. So the next slide, the family history. So her mother also had endometriosis, and that's not surprising given the family history and the genetic component to that. The mother also had asthma, father seasonal allergies. The patient birth history is also important. I look at that first year of life especially for setting up the good healthy microbiome, which is all of these symbiotic bacteria, yeast, fungi. It's that approximately 2.5 to 5 pounds of, again, symbiotic organisms in our digestive tract. But those things really help train our immune system, and they're involved in our overall health. And so it's great that she was born vaginally, but she was not breastfed, and so that can alter the flora in the gut and potentially lead to increased risk of allergies and eczema, as she's mentioned. So social history and lifestyle. Overall, there's quite a few processed and inflammatory foods in her diet, which, as we've talked about, can contribute to endometriosis. So she also had been previously treated with oral contraceptives. She had surgery about 6 years ago. She felt better initially, but the pain did eventually return. Again, that goes back to the underlying immune and hormone imbalances weren't addressed, and so that's why it came back. And so then the next slide, we'll talk a little bit about the labs. And so, based on her history, I really wanted to see a full thyroid panel with antibodies, reassess her iron and ferritin, complete blood count, a metabolic panel, vitamin D, and also hemoglobin A1C, which is blood sugar balance over approximately 3 months, along with fasting insulin. That blood sugar piece is also important for understanding potential sources of inflammation or imbalances that could really also be contributing to her current health complaints. Today I'll probably go into a little more detail on some of the functional medicine testing. So the Dutch dried urine hormone testing, and I have a little star next to it because I didn't actually run that for this patient. It's a newer test I started using, but I still wanted to show it because I think it would be really helpful for most endometriosis cases today. There's a micronutrient test, which I'll go into a little bit more detail on, and then a DNA-based stool test, which we'll also talk about. So physical exam was mainly unremarkable. She did have some discomfort with light abdominal palpation. And so then the next slide shows us the first page of a sample Dutch test. And so you can see it gives us a total, so if you look at the little stars, the star on the left is the low end of normal, the star on the right is the high end of normal. But you can see there's an imbalance between estrogen and progesterone. So estrogen is on the very high side, progesterone is low for this patient. And that's something that we do commonly see with endometriosis and other menstrual disorders. You know, estrogen dominance can be too much estrogen in relation to progesterone or too much estrogen overall. And so that is a common pattern that we see. Testosterone, so for this sample patient, it's in range. As women, we still do need testosterone. If you look in the lower left-hand corner, that's showing the cortisol pattern. And so we have something called a diurnal pattern with cortisol, meaning it's highest in the morning to give us that burst of energy, to get us up and going for the day, and then it should be at its lowest level in the evening so we can sleep and get good rest. And so you can see there's just a little imbalance here. She's on the, you know, just a little under the low end. She's not getting a good cortisol burst in the morning, and so that would correlate with some fatigue. There's also some more detail in relation to free cortisol versus total metabolized cortisol, and then DHEA is another adrenal hormone. And so, you know, always just looking, there's some more imbalances there as well. So the next slide goes into more detail about the estrogen breakdown. And so I'll focus just on estrogen just for the sake of time. But you can see the green arrow shows the healthy estrogen metabolism pathway. That's where you want the majority of estrogen to be metabolized as. And then the red is kind of the quote-unquote bad pathway, or tends to be the more problematic, that can potentially lead to DNA damage and potentially cancer if it's not in a good healthy range. And then the blue is the more neutral pathway. But if you go back to the green pathway, you can see the further breakdown by COMT. That stands for catechol O-methyltransferase. That's one of our genetic variants. So here we're tying in the genetics. But we can do things to support healthy COMT activity. Things like magnesium can help to support the function of that enzyme if the person is having low estrogen or methylation activity at that point. And then things like EGCG found in green tea and quercetin, those are really great healthy things, but they can actually block the COMT function. And so that's where it becomes important to know what other supplements your patients are on in case that could be potentially affecting that estrogen breakdown or metabolism. And so then the next slide, it gives us a little bit more detail about what's going on with the adrenal glands. But I also want to point out it shows the melatonin. And so again, melatonin, there's been some really interesting studies showing melatonin is helpful in endometriosis. It's a really important hormone for getting good sleep at night. And so I also like to take a look at that. And you can see there's more information about the cortisone versus cortisol, again, those adrenal hormones. So then I want to go next to the micronutrient test. And so if you look at the first page of the micronutrient test, you know, I'm always looking at individual nutrients, but I also look at patterns. And so, you know, I know you're probably not familiar with this test, but that first row, all the B vitamins, so those are all borderline and even low in some cases. And so when I see that pattern, it makes me wonder what's going on in the small intestine, because typically, if we're having trouble with absorption, the B vitamins are usually affected first. And so definitely, you know, that GI test, which we'll talk about next, gives us more information about that. But B6 is really important for the liver to process estrogen. And then if you look at the bottom right-hand corner, you can see that copper is elevated in relation to zinc. And that's something else I look at as being associated with estrogen dominance. And so then the next slide, that one looks a little bit more at some of the nutrients. That page looks pretty good. And so then I'll just go ahead and just talk about the GI test. Thank you. So this is a DNA-based stool test. And so this is the most advanced testing that I know of to really figure out what's going on in the digestive tract. So the majority of our immune system hinges on what's going on in the digestive tract. And so this test really provides so much great information. So if you look at the top, the normal bacterial flora, So the bifidobacterium species and the lactobacillus species, those are both low. And I really think about these as being so important for crowding out the bad bugs, so to speak, and really providing a good, healthy gut health. So that's a problem that those are low. If you look next, the Pseudomonas species are elevated. And again, if that lactobacillus is specifically is low, that can't keep the Pseudomonas in check. But also pesticides found in foods, so things like glyphosate and Roundup, those can contribute to Pseudomonas overgrowth. So that, you know, again, going back to trying to avoid those pesticides as much as possible in the diet is really important. And then probably the most problematic thing I see here too is that the Candida albicans is elevated. And, you know, increased estrogen, which is associated with endometriosis, is also associated with providing the environment for Candida to overgrow. And there's other things too, you know, high sugar, alcohol, things like history of antibiotic use, oral contraceptive use, all of those things can contribute to Candida. And so this patient definitely has that history or that background. And so then the last page of the GI map test. So this looks at some markers of digestion, but the really important one I want to point out is secretory IgA. And so Ig stands for immunoglobulin, and so that's an immune cell. And that secretory IgA is really our first line of immune defense for all of our mucous membranes. So things like eyes, nose, sinuses, mouth, all the way through the end of the digestive tract and then the vagina. And so their overall first line of immune defense is low. And then if you look at the next marker, anti-gliadin IgA, so that's just slightly elevated, but because their overall secretory IgA is low, that makes that more significant. So this patient would most likely feel better if they were avoiding gliadin or gluten in the diet. And then that last marker that's high, it's called beta-glucuronidase. And so this is an enzyme that can actually cause us to, you know, unbind estrogen from the protein it was bound to be excreted. It can unbind it and reabsorb it. And so then again, you know, beta-glucuronidase being high can contribute to that overall estrogen dominant state. And so then the next slide, we'll talk about some of the things that we did for this patient. And, you know, so again, we're always going to start with the basics. And so, you know, I felt like this patient really needed to have something she did for stress management, whether it's a mindfulness practice, meditation, yoga. Again, having that good family support is also important. So for diet recommendations, you know, again, avoiding those processed foods is really important. But I love, if any of you are familiar with Dr. Terry Walls, I love her 9 cups a day recommendation. So she breaks that down into 3 cups of dark leafy greens, 3 cups of brassica vegetables. Again, those are the smelly, sulfury ones that help with estrogen breakdown and detoxification. And then 3 cups of bright colors. Again, those bright phytonutrients, beets, carrots, berries. There's so many great, bright colored foods that can be health supportive. I do like bone broth. I think that can be very healing for the digestive tract. And then, you know, really high quality meats if your person or if your patient eats meat. But wild caught fish, fatty fish is especially helpful. So sleep hygiene, we definitely wanted to address that with this patient. Some nights she was only sleeping 4 hours. She wasn't waking refreshed. So I really wanted to address that with her. And, you know, we gave her the educational handout to avoid those endocrine disruptors or chemicals that can confuse our hormone signaling. Exercise and activity, spending time in nature, again, those things are really great for decreasing inflammation and also supporting stress management. And then gentle daily detox support. And so castor oil packs, I love it. They're very anti-inflammatory. They support healthy lymphatic flow in the digestive tract, and which supports immune function. Body brushing is great for lymphatic flow. Epsom salt baths, great for gentle detox. And then sauna and sweating, great as well. So then the next slide, talk about some of the supplements we recommended. And so, you know, I wanted to work on many levels for this patient. So first, you know, her ferritin, again, was a 2. So we really wanted to increase her iron. And so we did some iron bisglycinate, which I find to be much more gentle on the digestive tract. And then some other forms of iron. We did that along with vitamin C to enhance absorption. The bioflavonoids are really supportive for healthy blood vessels. So, that was to address the iron and vascular support. Next, we wanted to focus on reducing inflammation. And so omega-3s, EPA, DHA can be really supportive. And then liposomal curcumin. So this is from that turmeric, which blocks so many different markers of inflammation. And so curcumin is just really great, but specifically TNF-alpha and some of the others involved with endometriosis. We also wanted to support hormone balance. And so if you remember on that GI stool test, her beta-glucuronidase was elevated. Well, this calcium D-glucarate can help block that enzyme. And so again, to help prevent reabsorption of all the estrogen. I3C and DIM, that stands for indole-3-carbinol and diindolylmethane. And so those are compounds that support healthy estrogen metabolism. And so finally, we really, again, want to work on the underlying immune problem associated with endometriosis. And so we really want to help support healthy microbial balance in the GI tract. And so S. boulardii stands for Saccharomyces boulardii. That's a good probiotic yeast that can help crowd out candida, which is kind of the bad yeast. IgG or colostrum supplement. And so that's also really helpful for managing the balance in the digestive tract and supporting our own immune function. And then antimicrobial herbs. I do like to rotate these to really make sure we're addressing the yeast. Also want to make sure we're bringing that Pseudomonas species down that was elevated. And again, we're going to do that by avoiding pesticides too. Okay, and so the next slide is the follow-up. And so at 12 weeks, she was doing great with her diet. She was eating a lot of good healthy produce, more of a paleo-style diet, avoiding those refined grains and sugary foods. She was sleeping much better, and she's finally awake and refreshed. We had got her ferritin level up to 38, and so she actually ended up not needing the iron transfusion. So that was good. Energy significantly improved, and her pain and bleeding was significantly reduced. She also noticed the benefit of fewer allergy symptoms, and her eczema was clearing for the first time in a long time. So, really fixing the digestive tract, helping bring some of the things back into balance can really improve a lot of these underlying problems. And so, that was it for the case. And then, so we just had a few final things. So work-life balance, that's definitely still a work in progress, but one of the things I find to be really helpful is planning the week, prioritizing. Definitely anything that's important to you, it's important to just make sure that gets on your schedule. You also need to make sure you're following your own advice. Addressing the basics, making sure you're making time for sleep, eating well, exercise, hydration, spending time in nature, spending time with your family. I know that work-life balance is always a work in progress, though. And so then a day at the office, the next slide. And so who are my patients? And so originally, Dr. Bisco and I talked about really catering to the autoimmune population, just because conventional medicine doesn't seem to be able to, in a lot of cases, address those concerns very well. But we really found that a lot of our patients were just frustrated. They had complex health challenges. They weren't getting the help that they needed. And so we really decided to focus on helping the people that were just frustrated and not getting the help that they needed. We still have a lot of autoimmune patients, so I think that's just becoming more common with all of these exposures and things in our environment that can throw our system out of balance. So, so building relationships, I really view patient care as building a relationship with, every person is unique. There's no cookie cutter solution. You have to really figure out what's going to work for that person in front of you. So compliance versus adherence. So that's an interesting thing. So compliance really that suggests kind of conventional paternalistic approach. I really like adherence because that suggests collaboration. patient, sorry, my notes. Okay, that suggests collaboration. And so really, I think it all comes down to communication, really learning what's going to work for your patient, what's their specific case needing, and following up. So, I think patient follow-ups are really important. Don't assume that they've been able to try everything you've recommended. So I would start by asking, what recommendations have they had a chance to try? And then you troubleshoot as needed. If they weren't trying things, figure out why not, and then find something that will work for the patient. So a lot of this is, troubleshooting and modifying as you go, and really just working with the patients long-term to get them to their health goals. And so then tips for practice success. So the next slide. So I think it's really important to have a clear vision, really know your why, your mission, your ideal client, in really owning your practice style. Again, I think for us working with a business coach was helpful, and we've never owned a business before, and this just really helped us get clear about where we saw ourselves in the future, how we wanted to practice. And while it's important to have a clear vision, it's also important to be flexible. Again, we started out, with an autoimmune niche, but then we realized that our main clients were just frustrated. So we really wanted to send that message to really help people that aren't getting the answers that they want. I think it's, obviously be professional in everything that you do. Planning, setting goals, and measuring. I think that's really helpful to know what's working, what isn't working. Again, for us, measuring and working with that business coach was helpful for us to figure out some of these things. Maximize opportunities. So, I used to do kind of educational talks for people, but I realized that if you don't make them an offer for something specific, they don't really know what the next step is. And so that was also something that we learned working with the business coach, was just anytime you have a speaking opportunity, make an offer, and so they know what the next step will be. And so be open to new challenges. For me, doing webinars and video blogs and things like that are kind of scary, but they're very rewarding. And so just always be open and up for new challenges. I think that's an important part of growing and also reaching people. And then self-care, I can't emphasize that enough, how important self-care is too. Again, making sure you're practicing what you preach as well. And so the next slide, so looking forward, so future plans, again, we opened last September, so we're really continuing to work to build the practice. Eventually, we would like to offer online courses and scale so that we can reach more people. And then for the profession, I really think that it's just going to continue to grow exponentially. I mean, patients these days are smart. They're well educated. They have a ton of resources via the internet. I meet so many people that are frustrated with the standard of care, and again, they know that the quick fixes and pills aren't always the answer. And so it's just really great to be a resource for these people and to help them. And so advice for prospective students. And for me, I really think one of the things that helped me kind of figure out how I wanted to practice and the population I wanted to work with was I shadowed a lot of other doctors. I created additional medical rotations for myself, and I learned something new at each place about how I wanted to practice. I learned practice tips. There's just so many things you can learn just actually trying out different approaches and different practices. And so I think that was, even if you're shadowing just for a day, you'd be amazed how much you can learn. And so then I think that's it. Yeah, and so then the last slide just has my contact information. I hope this all made sense. I know I went pretty fast. So, but I'm happy to answer any questions.
Dr. Egeland, thank you so very much. I really appreciate this. And one of the things that you just said about having a clear vision is so vital. I hear from prospective students all the time, and even current students and recent graduates, oh, well, what am I going to do, and how am I going to think about this, and what is this investment in my future? And having a really clear vision of the investment of naturopathic medical education in your personal life and your future and what that means to you, your health, the health of your patients, the health of the planet is really one of the defining factors that I see with folks who really do well. And they have a clear vision, they know what they want, and they make a plan to get there. And
Mm-hmm.
so thank you so very much for sharing that. So we have had a bunch of questions come in, but before we get to those, I wanted to just cover the upcoming events. So if you go to the AANMC webpage, uh, we always keep our events updated, and we will be able to invite you to all of our upcoming events. So next month, in June and July, we have events on oncology and cancer and naturopathic approaches to those illnesses. So again, thank you so much. So I'm going to get the regular screen back. Forgive me, my PowerPoint here has been kind of acting wonky today. It's one of those technology days, I think, where things are just acting weird. So we'll just leave it at that. So if anyone has any further questions after the end of the webinar, I will be staying on for a little bit, and you're always welcome to send any questions to info@aanmc.org. That's info@aanmc.org, and we're always happy to share and help you along your path. So there are a few questions for you. Can you explain briefly retrograde menstruation?
Oh, yeah, that's a good question. So the way that I understand it is you get essentially like a backflow through the fallopian tubes of the menstrual blood.
Yeah, and that's one of the theories behind endometriosis, is that the blood actually does not go out. And so I know a lot of docs recommend menstrual cups, not using tampons, not doing any type of inversion yoga, anything where you're upside down during your period as well.
I have heard that, yeah.
Yeah.
And I think, oh, sorry.
Oh, go ahead, please.
Oh, I was just going to say, and again, I think that happens in over 90% of women, but the real problem comes in when you have that underlying immune dysfunction where your body can't clear that extra blood or the tissue.
Yep. So there's a question about cortisol and how you work in getting it regulated.
Oh, that's another great question. So with cortisol, there's a lot of different things to look at. You have to look at, also thyroid hormones, and we didn't really get to that in this talk, but, I love botanical medicine. We have some amazing adaptogen herbs that really help the body adapt to stress. So, it's always a combination of lifestyle and then supporting people with some of the herbs. Typically there's also phosphatidylserine, some other nutrients that can be really helpful too. And so it just kind of depends on what type of imbalance there is in the cortisol, and that's why I really like to get the cortisol curve, because you would support differently based on how that curve looks, or that diurnal pattern. So if they're not getting that good burst of energy in the morning, you might recommend a little bit of light exercise to help boost that. Again, supporting the adrenals with good nutrition is always a great foundational thing. Things like vitamin C, B vitamins are supportive, and then again, those adaptogen herbs, which again help your body adapt to stress, can be really helpful.
So there are a couple of business questions, and I want to make sure, because we always kind of hear from folks on, how do you get started? How do you have a successful business? And so a couple questions came in just in regards to why you chose Colorado, how you got your business started, did you need to take out loans? And, again, some of these are personal, so just share what you're comfortable with. But, how do you get started, and really what was your kind of tip for getting your own business started?
So for me, I kind of joke the reason Colorado is my husband is he's always wanted to move out west. And, around the same time he was talking about wanting to move, Ashley and I were friends from medical school. She told me she had also been looking at Colorado to move and open a practice. And So we just got to talking, and it lined up perfectly for both of us. We were looking at living in the same area, and so I feel like it just kind of lined up almost serendipitously, but it really lined up perfectly for us. So my husband previously had been a business owner, and so he's just always had that mindset of opening a business. And Ashley was really wanting to open a business, and so I had that encouragement from both sides to open a practice. And again, having not been a business owner, I felt that it was really important to make sure we're doing everything we can possibly do to be successful, and that's why we hired a business coach for the first 6 months, and I think that was really foundational for us in getting going. As far as the finances, we both contributed some of our own money, but we also took out a 0% interest, so an interest-free credit card. So we had 0% interest for 1 year, and we had a pretty high limit, and so that was also really crucial in supporting us financially and getting started. And luckily, we did well right out of the gate. Her husband actually built our website for us, and we've just had everything fall into place really well for us. But we were also really intentional about what we did, and did everything possible to make sure that we will be successful, and again, intentional about what we're doing.
Fabulous, thank you. Can you speak a little bit so there are a couple questions on the patient case. And really, just in general, folks are asking, I have a few questions on how long people need to be adhering to the protocols before they start to see benefits, and before they can maybe start to back away from all that long list of supplementation.
Yes, I'm glad you asked that. I was actually going to point that out too, that my goal is never to keep patients on supplements long term. I try to manage with diet and lifestyle as much as possible, but sometimes to really get a shift, especially initially, I do use supplements. So and the other thing I was going to point out too is botanical medicine can also be really helpful for balancing hormones, but I'm always cognizant of not trying to do too much at once, and so this is probably about the most I would do typically supplement wise. So with female hormones, and specifically endometriosis, I do find that it takes a few months to make a shift. Some people start feeling better within the first month, but it really depends on the individual and how many other things they've been able to do, if they've been able to follow some of the other diet recommendations, and making sure they're doing good self-care. But I typically find, 3 to 4 months, you can make a huge shift and then start weaning people off of things. But again, it's always situational. For instance, with this patient, as soon as I got her ferritin level up to, the 30s, I supported with, I definitely decreased what I was doing with the iron and the vitamin C. I do think longer term, I would keep her on the omega-3s. The curcumin, if her pain, as long as her pain stays at a manageable level, I'd probably start limiting that. Ideally, I would like to retest that GI map test to make sure we've cleared the candida and make sure that beta-glucuronidase enzyme is back into a normal healthy range. So I would probably recheck her GI test at maybe about somewhere between 4 to 6 months, just to make sure everything's back on track. And then based on how she's doing with her digestion, and if those IBS symptoms are gone, we could definitely look to decrease those GI supportive supplements as well.
Awesome. So there are a couple questions. Can you speak to how you addressed the allergies in the case, and how you did that?
Yeah, definitely. So really by fixing the immune imbalance, and so that candida infection, and maybe the pseudomonas, but definitely that candida infection can be a chronic source of inflammation in the digestive tract, and the majority of our immune system hinges on what's going on in the digestive tract. So by addressing that candida and that chronic source of inflammation, that brings the overall levels of inflammation down. And I find that people's allergies and skin conditions like eczema really start to clear once you bring the gut back into balance. So really, what's showing up on our skin is a direct reflection of what's going on in the digestive tract. And I find with seasonal allergies and food allergies too, those are usually secondary to some kind of inflammation or imbalance in the digestive tract. So by fixing that, you really fix a lot of other systemic issues.
Awesome. Uh, let's see. I've got a question about alternatives to brassica for people who have hypothyroid.
So, oh, that's another great question. So with the brassica vegetables, so those are generally considered goitrogens, which means that they can block some of the iodine uptake by the thyroid. As long as you're cooking those or at least slightly steaming them, that should inactivate those goitrogens. So, cooking them, it's perfectly fine with a thyroid problem. And again, most thyroid problems are due to an autoimmune reaction. And so again, you have to figure out what was the immune trigger that caused the autoimmune reaction and treat that or address that.
Fabulous. Can you speak a little bit about, I know you mentioned pesticides, and I know the evidence base is still developing for pesticides and environmental exposures, but just some of the connection between pesticides and gut flora?
Yeah, that's a great question. And I went to the environmental medicine conference last year, which is a really phenomenal conference if anyone ever gets to attend it. But that was one of the really important topics was the glyphosate and the Roundup and all of the ways it can really throw our system out of balance. And then, I mentioned the Pseudomonas species specifically. They seem to thrive really well with glyphosate. And so when I see the Pseudomonas species high, I do think about, okay, what's been their pesticide exposure? But I'm sorry, did I answer, was there another aspect to that question?
Well, just the connection with gut flora.
Yeah, so but yeah, there's still a lot of studies coming out, but there's also, there's just a lot of research. It can definitely throw off the balance of the flora. It can inhibit the lactobacillus, which again, the lactobacillus is important for kind of keeping other things in balance, and it does promote that Pseudomonas growth. There's also some research showing that with the genetically modified foods that there's some translocation between the genetics of the GMOs with the bacteria in the gut as well, which can further throw off the digestive flora balance.
Excellent. So there's a question about, and this is one that I'm always juggling too. So how do you personally get to the point of self-care? I know, if you're busy building a practice and working, and I am as well, and balancing family and responsibilities and all of that. I've got a person here who's working third shift in sleep medicine field. So it's kind of ironic she's in sleep medicine field and it's hard for her to get the right sleep. But how do you personally balance self-care?
Yes, so that is $1 million question. And when I say it's a work in progress, it's definitely a work in progress. I just try to change things up. I try to figure out what's working for me. I know personally that I have to make time for exercise. That's good for my body. It's also good for stress management. And so I schedule that in. So anything that's really important, you just have to schedule it in. And sometimes you have to be flexible. I think if you strive for perfection, you're just going to be frustrated. Some weeks just have to do the best you can, but again, prioritizing and scheduling, and that's where planning the week is helpful as well. But I don't have the perfect formula. I think, as you pointed out, it's a struggle for many people.
Yeah, I think personally, like you said, scheduling, planning as much as is possible. I always try. I've got a 4-year-old son, and I was talking to him yesterday about the word proactive. And not waiting until something's on fire to get to it, but trying to handle things so that you can actually relax at the end of the day, and have a little bit of time for self-care. And so I think being proactive, getting as organized as you can, are some of the tools that help me. And then, in all honesty, having a good sense of humor. I think,
Yeah.
for all the planning and all the organizing and all the trying to get everything right, at the end of the day, life happens. and sometimes you just have to roll with it. And so I think, that they're just, it is what it is. And, like you said, you have to roll with it. And I think having a good sense of humor can also help. Sometimes things just happen and you can't control that.
Absolutely. I love that though. That's definitely humor can be a lifesaver.
Yes. So we have time for just one or two more questions now. So there was a question about iron and why you chose the type of iron you did and what kind of iron you tend to supplement with.
So the iron bisglycinate, it just tends to be more gentle on the digestive tract, and then vitamin C enhances iron absorption. And so when I really want to boost someone's iron, I'll do vitamin C with iron with meals because that's when we're really going to be absorbing most of those nutrients. So I mean that's why I chose that one. I know there's other forms out there. Some tend to be more constipating, and there might be some that work better for certain individuals. This is just one that I've used with good results.
Sure thing. And so I think we'll take one more question here. And I know some folks have been asking some personal health questions. And so in the case of personal health questions, this is a very brief webinar, and it probably won't serve anyone well to give any personal advice here. So I will say that for personal issues regarding female health or health in general, it's best to connect with your own physicians. And if you want to find a naturopathic doctor locally to you, the AANP in the United States has a listing to find NDs, and the Canadian Association of Naturopathic Doctors also does as well. So those would be two really good tools if you are trying to get connected to an ND who can help you with some of the things like Dr. Egeland has talked about today. And so with that, there's one last question here. There was a question about curcumin and black pepper. And do you know anything about the relationship?
Yeah, so black pepper enhances the absorption of curcumin, and so a lot of formulas will put black pepper along with the curcumin. And then there's some also studies to suggest that a liposomal or because curcumin is more fat soluble, that also helps to enhance the absorption.
Fabulous. Well, I'll stay on and answer a couple more questions. Dr. Egeland, I appreciate your time. I know that we're right at the end of the webinar today, and I thank you so very much for joining us today and for all of this fabulous information. So
Thank
with that,
you.
we're going to thank you. So we're going to end the webinar. As I said earlier, there will be a recording later on today on the AANMC website. And with that, we conclude the webinar, and I'll stay on for questions. Thanks all so much for coming.